Good afternoon, everyone. It is the THCB Gang, episode 32. I'm your host, Matthew Holt from THCB. Really special gang with me today. We'll find a bit more about that. A new face for the gang, and an old face is going to be departing. So anyway, here's our guest lineup for today. It is the 12th of November. Either 9 days after the election in the US, or some way to go till the election's decided, depending on your political viewpoint, I guess. And here's who we have on today. Returning, we have my co-host from Health in 2.0 and the host of WTF Health, Jeff DeMassa. Jen Benz, communications lead at Siegel Benz, and expert in all things to do with employers and employee healthcare. Saurabh Jha, regular contributor to associate editor at THCB, but also in his day job, professor of radiology at Penn and a rogue on Twitter. JL Neptune, founder of Sunshine Modern Recovery and general at the MD-MBA type from New York City. Zoya Khan, editor-in-chief at THCB, and we'll talk a bit more about Zoya's future in a minute. And our special guest this week is Jeff Goldsmith, who's president of Health Futures Inc., one of the best-known health futurists in America. I would say one of the two best-known health futurists in America, because the other guy, Ian Morrison, is quite a fun of the show too, and I want to get them on together one day. They've known each other very well. All right, so with that, we're going to go live and see how everyone is doing. Oh, we lost JL. JL, you've got to come back.
I'm here. My video, for some reason, is glitching, so I'm going to try to come in on another device, okay?
We'll wait for you, JL, and audio around, but let's start up. So, hi, everyone. It's been quite an eventful week. I think we're figuring it out. So let's go quickly around the horn and see what people are thinking about what they've seen this week. And Zoya, I'm going to make you start with you.
Wow, to be given the honor. Thank you so much, Matthew.
The first and last time.
Very true. So I think I'm echoing just a touch, but my sort of update from the field is seeing that COVID-19, the vaccine that just came out, I mean, there's a 90% efficacy, there's all of these sort of things around it, but really what I'm looking at is the couple who created it are immigrant couples, and they were immigrants to this nation. And when you're looking at how the changing administration, just their policies around immigration, and how, we've had so much animosity as a nation towards immigrants, and now with the new administration sort of really bringing light and shedding light on contributions made, especially in healthcare by immigrants to this country, is just really, really uplifting, and it couldn't come at a better time. So I'm really excited about that news.
Excellent. Saurabh, what do you think of the last week?
Yeah, it's been pretty exciting. The obvious news is the vaccine from Pfizer. And the interesting thing is the response to the vaccine from Pfizer, which the fact that the CEO sold some of his stock seems to have taken wind out of the actual achievement, which has been extraordinary. If you go back to the beginning of the pandemic and you listen to what experts were saying, and I use experts in a very narrow sense, not in the broad sense in which everyone is an expert. So immunologists, infectious disease physicians, people that had developed vaccines before, they were saying that you weren't going to get a vaccine before middle of 2021, to say the least. By not getting a vaccine, you mean going through phase 3 trials, and distribution by the end of 2021, which meant that, either you'd rely on herd immunity or lockdown till then. And the fact that you have a vaccine by the close of 2020 is extraordinary, absolutely extraordinary. And it would be very disingenuous not to give some of the credit to the Trump administration for enabling this. Whatever they did, they certainly didn't block it. And I thought the Pfizer spokesperson who said that we didn't really take part in the operational warp speed was a bit, ungrateful, given that the federal government promised them a huge amount of money if they came out with it. But it tells you, with pharma, you show them, you dangle them the dollars, and like hyenas, they come running in. There's nothing wrong with that. Greed is good.
Greed is good.
As the Wolf of Wall Street said.
It was
Gordon Gekko said that, actually.
Gordon Gekko.
Gekko.
Jen,
Well, COVID is very top of mind for me at the moment, in a very, very personal way. I have two sisters in two different states who seem to have both had it in the last 2 weeks, despite all precautions and so forth. And so they'll both be fine. They're both healthy, but I just think it's too close to home for a lot of folks right now, when we're having these big third waves or second waves, kind of however we're counting. And the vaccine news is great optimism for the future, but we are still in this very murky environment where we have so many different points of view on what folks should be doing, and how to just behave in public life. And I think it's a very murky time. And I'm here in San Francisco, where things were looking really, really good, and now the numbers are going up again, and some of the opening that's happened is going to be scaled back. So that's really most top of mind for me at the moment. And we can talk more about that and so forth as we get into things.
Yeah, it'd be interesting to see your view on the impact of that and what employers are going to be doing. JL, I'm not allowed. I can reveal again that I violate HIPAA. Was it $5 million a word for my client? That you've been through the COVID thing once already. Hopefully, look for worse than last time.
Yeah. I think, the big story here in New York, and I wasn't going to lead with this, but I'll drop it and I'll talk about something else as well, is it looks like, we may be getting ready to enter into another shutdown. The governor just announced that restaurants and bars have to close at 10 p.m. The mayor is signaling that they may have to close the schools down. So, it looks like it's getting real here in New York, in a place where we were very, very responsible, I think, in terms of how we approached this. So that's building on the prior comment. And then the other thing I wanted to say to lead is what many people may have missed with all of the noise and all of the things going on with the election is that a number of states passed legislation to make marijuana possession legal. So states that you wouldn't typically think of being as progressive states, Mississippi, South Dakota, Arizona, Montana. And it's very interesting because I think with a Biden presidency, we may be seeing the dawn of a much more progressive approach to drug regulation and hopefully drug treatment, which is obviously something that I'm very, very serious about. And obviously, I'm building a business around that. So I thought that was interesting and something that was underreported and probably in a prior election would have been, top line.
I'll be moving to Oregon to take some magic mushrooms, I think, next week. Jessica, speaking of magic mushrooms, I don't know why I brought that up for you.
Did you say
Jessica,
me?
I just made that up.
Okay, first of all, I think I was less startled by the magic mushroom thing and more startled that you called me Jessica. I was like, what? Who? Okay. I think it's been 3 years since you used my full name. Okay, so I've got my eye on the ever sexy topic of health insurance. The Affordable Care Act is being reviewed, where the hearing is happening right now as we speak in the Supreme Court. This is unfolding in real time. And it seems like the last thing I read, and correct me if I'm not as up to date, but the individual mandate, it sounds like they're going to get rid of, but they're going to keep the rest of it intact. That's the last thing I heard. Everybody's nodding. Okay, good. One other thing on this, I came across this yesterday. So the Urban League has published an analysis backed by the Robert Wood Johnson Foundation. And this is like clearly a piece of reporting that's meant to underscore the importance of the Affordable Care Act. But basically some of the statistics that were in it was talking about the number of people who have lost insurance in this pandemic. And so that number is at 3 million. 3 million people who have lost their employer-sponsored health insurance. And what they're saying is that those people are going on Medicaid, is what they believe is happening. And the reason for that is because in looking also not only at that number who have lost it, but the number of the uninsured rate hasn't changed in a statistically significant way since March. So they're assuming that those people still have insurance, that those people have gone to Medicaid, and Medicaid was shored up by a lot of the things that were enacted as a result of the Affordable Care Act. I guess another piece of this that I'm keeping my eye on too is how this is impacting hospital and physician office revenue. So they're predicting that that's going to be in a lot of danger if this trend keeps happening, where people are losing their employer-sponsored plan, they're getting on Medicaid. Who knows what's going to happen because of the Affordable Care Act? But next year, revenues in hospitals and in doctors' offices probably going to be down. And that to me matters because I need those people to invest in digital health solutions. Otherwise, I'm out of a job. So that's what I've got my eye on.
And Matthew, not just next year, this year, right? This year is going to be a disaster financially for most hospitals. So
yeah,
I was giving a talk about Salus revenues, and they're down 600 million this year. On the other hand, they do have 5.5 billion in the bank, so my heart is not bleeding quite yet. I'll run with my comment, then I'll introduce Jeff a bit. So my comment is, I saw a study that I'm not sure what the study was, but Eric Topol was tweeting out about it, which looked at people who had COVID. 20% of the people who had COVID were unable to return to work because of health issues, not because there wasn't a job. There are other bunch who couldn't get back because of the job. But this issue of the serious impact of the morbidity of COVID plus the longevity of it is really serious, and you're seeing that across the world as these rates go back up. So with that, Jeff, I want to introduce you very briefly. Jeff's been a buddy of mine, written on THCB, which is obviously his biggest accomplishment ever, but otherwise has been one of the best known health analysts, forecasts, and futurists in America for many decades now. And Jeff, you wrote a piece just this weekend, which is on THCB, about what you thought the impact of a Biden administration would be on the healthcare system. So I'd love you to wax a bit about that and tell us what you're looking at.
Well, I mean, it's one of those good news, bad news things. We're actually going to have a caring, professional health policy operation in the White House and in HHS in a couple of weeks. That's the good news. The bad news is that they're inheriting the worst federal fiscal situation we've ever seen. Fiscal 20, which closed 5 weeks ago, $3.1 trillion deficit. The first month of fiscal 21, October, $284 billion deficit in one month, and a forecast without any further fiscal stimulus of $1.8 trillion federal budget deficit for the fiscal year we're in, which ends in September of next year. So you get a caring person that's going to have a professional health policy operation and no money to do anything with. So what I said in the piece in THCB was, I think the coverage expansion is pretty much not going to happen. They're going to slow walk it. They're going to talk about doing it, but not do it. And that's going to push them in the direction of what are the things that they can do that will help further their agenda politically without spending any money. And the two things I talked about in the piece were facilitating unionization of healthcare workers, not just nurses, but doctors as well, a huge chunk of whom are employed by hospitals and are frankly not very happy about it. But the other thing is antitrust, going back and really looking at the huge market concentration that took place during the last 4 years in health insurance and in care delivery, and beginning to send a message that people that are merging to try and get their rates up are probably not going to be very well received during this administration. People forget that Kamala Harris was on this issue very aggressively when she was Attorney General in California, and her successor, Javier Becerra, a landmark antitrust settlement with Sutter Health. So I think that facilitating the unionization of healthcare workers and going aggressively after the market concentration in both health care delivery and health insurance are going to be the two things to watch for in this next 4 years.
Jeff, have you been, I mean, those points are really well taken. Have you looked at and I've seen one startup came and presented to me about how nurses have been, especially in the sort of, the April, May, June timeframe, and hospitals were starting to lay people off. There was a lot of layoff of nurses, and a lot of nurses are now out there are sort of independent. And I'm always balancing this because we spend all this money on the hospital system, and you and Ian Morrison and a million other people and me have been talking about the concentration and the pricing we see in the hospital systems. And there are all these people, you know, that JL and me and Jess and Sarab laughs at, but have been talking about for these years about we're going to build a new digital health system around the hospitals. But then again, they are this huge area of employment. And as you mentioned, you know, it's an area where if you can shore up the union base, you probably get a better sort of bang for your buck politically as a Democrat.
Right.
Have you, you know, there's been some back and forth with HCA and unionization and elsewhere, but when you drill into that issue, can you say a bit more about what you think the sort of where we are now in that and where the net result might be?
We know that I was just listening to NPR this morning, and there was talk about hospitals in the Dakotas that are basically telling asymptomatic COVID positive nurses that they have to work. I mean, that's just like kerosene fumes in the labor management environment. You know, I mean, it isn't just because it's going to make people that are coming to the hospital feel that they're not entirely safe, but we're burning out a caring workforce that's just left it really all out on the field here in the last 8 or 9 months. And if managements don't do a more effective job of communicating to those folks that what they're doing really matters and it's really important, and not just in rhetoric, but in getting them the protective gear they need and making sure that they get the IT support that they need, and that they're not, you know, they're not going to be burned out. Unionization is just, I mean, it's just such an obvious way of redressing a lot of those concerns. So I'm really very anxious about the state of our healthcare workforce right now. There's just exhaustion, rampant depression, anger, boiling under the surface while they're trying to help us. You know, Matthew, the thing that is just boggling my mind is the slope of the curve, both on new cases and deaths. We're going to lose more people to this pandemic than we lost in World War II before we're done with it. I mean, I don't care how fast they deploy those vaccines. We're going to lose at least 400,000 Americans to this disease. And I mean, everybody, you know, Jen, my sister and her husband have COVID. Mm-hmm. I mean, it's literally touching everybody in our society right now. And God, I wish January 20th was tomorrow.
Mm-hmm. Well, let's talk about that pit, because no one mentioned it, which I was surprised, is that given on, you know, as far as I can see, we have, you know, the president of the Prime Minister of the UK and the presidents of every nation being congratulating Biden, going around the way they would normally do it, because he's not yet been admitted by the current administration as being the president-elect. And we have all this talk about, you know, I was on a call the other day with a bunch of was on a presentation. The media presentation had 5 lawyers on it, and I said, well, I want to thank the lawyers for taking time out of their busy day filing frivolous lawsuits about election fraud, right? Because that seems to be what's going on in the country. I mean, what do we think about the role, given essentially, as far as I can tell, the Trump administration has given up on this. Biden has put together his task force. He's got Ron Klein, who headed the Ebola task force, this new cheaper stuff. But they don't get to do anything for, as you said, till January the 20th. I mean, what do we think the impact, maybe Sarah, if you have a comment here, the impact's going to be on, you know, all the stuff we're talking about doing in terms of getting the vaccine going, getting the PPE going, you know, dealing with the second or third or fourth wave?
Yeah, I just want to make one point of it. Not sure if I should go first. I don't think that there's anything magical that's going to happen on Jan 20th. And this idea that we're in, you know, this darkness and Jan 20th is the sudden light, what's the Biden administration going to do differently? The reality is that we have considerable spread right now of the virus, so much so that that the distinction between pre-symptomatic and asymptomatic is pointless. Millions have it. There's cities with about 15-20% that have had it, which means at one point they had it. And all of this was preventable around February and March. I don't want to keep digging the past, but, you know, the Mr. Klain, the chap who's taking over the White House, on February 28th tweeted that he wanted New Yorkers to go and visit a restaurant in Chinatown, obviously to reduce racism and stigmatization, but that was when you had to curtail people's movement. that was when you had the opportunity, but that was lost in politicization and all the other things. And right now, yeah, America is up shit creek, but I honestly don't think that there's a change in regime is going to magically deal with that. You have a vaccine that's come out, and we should celebrate that. I'm quite surprised that people aren't using that as the, that is our January 20th. It actually happened on November the 9th. And it's arguable that it could have happened earlier on, but it's politics, it's okay. And that's what we should be celebrating. And we should be thinking to ourselves how we can maximally get the vaccines to maximum number of people. Now, it's not going to be easy because people have already started questioning the vaccine. That's not the 90% efficacy that they're questioning, they're questioning the safety. And with any time you question something, you might think that you're doing a service to public, but you're also sowing doubt. And the doubt has been sowed. I mean, people have called this a Trump vaccine. I'm really kind of, a little annoyed that even before the vaccine came out, it was assumed that the FDA was going to just approve it. And so, we're in a bad situation, but we have to be really honest why we're in this situation. And nothing magical is going to happen on Jan 20th. We have a double standards to protests. When it's done for what we perceive to be noble causes, we're okay with it. The medical profession has lost the confidence of 75 million people. And that's not a small number of people we're dealing with. We're not talking about just the odd barber down the road that you can slap on the face and say, hey, why didn't you agree with me? We're talking about 75 million people. And it's absolutely ridiculous. And I don't think Jan 20th is going to fix that. There's a lot of work to be done. This was an awful year. We had an awful president. We had a politicized medical profession, which suffered from Trump derangement syndrome, and it's just been all on awful. And I disagree with Jeff Goldsmith that something magical is going to happen on Jan 20th. I honestly don't think it's not. I think that the time is now. We shouldn't wish for Jan 20th. We should do what we can do right now to get the vaccine deployed and to be deployed without fuss.
Yeah, Sarah, I'm not implying that Joe Biden is going to come riding in on a white horse on January 20th and this is all going to go away. That wasn't what I was saying at all. But the idea of an administration that actually believes in public health, believes in science, and begins what is probably going to be a multi-year task of rebuilding both the cadre and the credibility of our public health system, that's the stuff that starts on January 20th. There's a tremendous amount of work to do, not only mitigating harm here with this pandemic, but getting us ready for the next one. I mean, the idea that we spend $750 billion a year on our armed forces to protect ourselves from, some type of armed attack, and we spend $100 billion a year in a really poorly articulated way to protect ourselves against what's killing tens of thousands of Americans, a month. That's what I think starts changing on January 20th. Not that this pandemic goes away.
And Matthew, go ahead, Sarah.
I agree with you, Jeff, but I do want to say something that I think there's no doubt, nobody over here is going to say that we have the right person at the helm for the pandemic, but I don't think the medical profession or the public health did their credibility any good by the way they behaved during the pandemic. And at least the beginning of the pandemic, the mixed messages that were given between, it's all okay, go and enjoy yourself and go on a cruise, and then all of a sudden, don't wear a mask and then wear a mask. I've been pro-mask right from the beginning, because I didn't believe these idiotic empirical studies. But in the beginning, I don't know if I'm on Twitter a lot. There were doctors that were saying, "Oh, you're an idiot for wearing a mask." The same doctors now saying you're an idiot for not wearing a mask. So first they started off saying you're an idiot for not. Now you are. We need a huge introspection in the medical profession, how we have behaved, and it's very easy to push this to the orange man, who no doubt is an asshole and an idiot, but this hasn't been our finest moment either. And I don't want us to, I don't want to exculpate ourselves because we have somebody else. We should have been smarter. We should be more evolved, and we weren't. And the number of things that we did wrong And I think it is worth going back and looking at that, actually. Actually, I contradict myself. Yes, we should visit the past. So I don't think Biden is going to change inherently our deficiencies as a medical profession. And this wasn't the first time. In the Ebola crisis, we politicized the whole thing again, and mocking people for being afraid of the virus, for saying, oh, you want flight banned to China? Oh, you're a racist. This politicizes it. This makes a caricature of pandemics. We didn't arrive this. Rome wasn't created in a day. New York's pandemic wasn't created in a day. It took years and years of politicization to create what we have created today.
And Matthew, just to jump in. So a couple things. So I'd say first, I do think that there are going to be material changes that impact this pandemic beginning January 20th. I think first, just having leadership that communicates in a consistent way and provides a consistent narrative to the American people, I think will help dramatically, particularly if that leadership is focused on adopting public health measures that can prevent the spread of the virus, which I think the incoming Biden administration is going to be about. So I think if we have a president who is regularly wearing a mask, modeling that kind of behavior, everyone in his cabinet is modeling that behavior, even for the people who didn't vote for Biden, I think that that's going to have an impact on how they behave. And the more people who wear masks, the less spread of the virus that you'll have. So I think that that's one change that happens as of January 20th and happens very quickly. I think the second thing is it's been very clear based on some of the stuff that I've read, particularly some of like Jake Sherman's coverage in Vanity Fair, that the Trump administration gave up to healthcare.
We've lost you, JL. So I think Zoya, do you want to bump in here and we'll get JL back? JL, we've lost you for a second.
Oh, did you lose me?
Yeah, we'll lose you. We're gonna bump into Zoya and we'll let you play with your connection.
So what I was going to say, and kind of agree with Jeff, is on what we're going to see in January is a proper distribution of these vaccines. I mean, a proper way and a proper structure to go back to how healthcare was, almost maybe not for the negative sides of it, but actually a proper distribution channel that will allow, you know, this whole nation to benefit somehow. But my disagreement comes from in terms of, you know, I think what JL was saying in terms of, you know, people wearing masks and seeing a leader wear their mask. We have to remember that he's not the leader to 67 million people that voted for Trump, and people who are angry about that. And there's this animosity that's coming from those nations that are also the reddest. And I mean, in terms of COVID, their rates are so high and they're refusing to wear a mask. And just watching the news and watching the protests happen, I don't know if, you know, the current administration can make those sort of safety precautions and measures forcible on those people. And I think dealing with that population that doesn't agree with, you know, as Saurabh was saying, the politicization of this disease and this virus, how are we going to teach them what to do as many Americans, you know, lives are lost in this? So that's what I'm actually quite concerned about, that, you know, that 67 million, they don't care that, you know, Biden's their president. They're still rooting for Trump.
Well, and, you know, I've been actually talking about this with some colleagues of mine, is how would this have been different if Obama had been president when this blew up? He would have listened to the CDC, to Tom Frieden, whoever was in there. He would have taken this very seriously. And then he would have run into the brick wall of a whole bunch of Republican, libertarian-oriented governors who said, buzz off, buddy. We're the people that are going to decide what happens in Florida or North Dakota or whatever it is. And I think Biden, I think that's a huge constraint on what he can do, because he's going to be, and it's 72 million and counting that voted for Trump, 20 angry state governors that basically don't want the government telling people what to do. I think Biden's going to have a tremendous amount of difficulty with the messaging and in communicating with people and trying to persuade them that it's in their interests to be safe.
I think he's going to be
and I think the Obama folks, I mean, the problem with the Democrats is that there's this technocratic bias that everybody sees the world exactly like we do. We're scientists. We have PhDs from these fancy universities. They bollocksed up the messaging on Obamacare terribly. And they would probably have bollocksed up the messaging on this too. I think it's a very tough challenge communicating with the people that you just talked about, Zoya, and their political leaders.
Jill, are you back?
Yeah.
My question?
Can you see me?
Yeah, we can see you in here. So do your second point, and then we'll go to Jen.
Yeah. So again, the first point I was making is, again, I think, having the right modeling, even for people who didn't support the president, just hearing who don't support Biden, just seeing consistent behavior, I think will help people. I think that the constant changes of perspective and narrative from the Trump administration just confuse people. And at some point, whether you support Trump or not, you just got confused. Whereas I think if you hear consistent messaging, you'll be less likely to be confused. Number one. Number two, I think there's been very clear reporting that Trump and the shadow task force led by Jared Kushner and other people, they essentially gave up on PPE. They gave up on a national testing plan. Both things that we know could make a huge difference. PPE in terms of protecting our healthcare providers, and a national testing plan that can help us.
Oh, we lost the
identify people.
One second. All right. Well, I mean, we get your point about that. All right. I want to come to you, Jen, because you've been looking at it from the employer perspective. There's a lot of conversations out there about who is providing testing, who's providing PPE, who's providing, who's providing the next step, and how do people go back to work and when, right? So I assume that a lot of the people you've been talking with have been in that. So I love your impression, your impressions of where we are in that question now.
Yeah, well, I'll echo what JL said in terms of the leadership on this matters, and I do think that large employers have provided really strong leadership in many cases where there's been a vacuum in the national and local government leadership. And I think we'll continue to see that. The employers who can take a very, very slow and conservative approach are doing so. And we see, the tech companies and other professional services firms keep kind of pushing out their work from home date, basically saying like, we don't want to deal with this until things are more certain. But that doesn't change the fact that a lot of people don't have the option to work from home. And to the earlier point about the stress on healthcare workers is tremendous. And we see across all sectors that mental health is a huge, huge issue right now that's not getting the attention that it needs. And, it's one thing to talk about mental health when you work in a knowledge industry and you're in front of the computer every day and you're dealing with your kids and so forth. That is a stressful situation. It's a whole different level when you are interacting with COVID positive patients every day and you're not getting the support from your leadership and you don't have the flexibility or you don't have enough sick time and so forth. So I think we're going to see this very different situation where we have a lot of folks who still have the luxury of being from home and being kind of protected from a lot of what's going on. And then these issues with frontline workers that are going to get to crisis proportions at the same time as the virus continues to spike. And I do, one comment on what Jeff said about the messaging around Obamacare. It took 10 years for the Democrats to get clear on the messaging around Obamacare and for people to finally get it in their head, like, oh, pre-existing conditions. And there's just got to be better, simple messaging around public health and why this stuff matters. And I'm optimistic that we'll get some of that with a new administration in place, but it's going to take a while for people to get their confidence back.
But Jen, I want to ask you one follow-up on this because you sit in there talking to a lot of these large employers who you're working with. There have been, I think Jess, you brought this up on an earlier THCB game. There have been some questions, some suggestions that everyone's a healthcare company now, and everyone has to think about this. Whether you're managing employees, on a line at a factory or a meat packing plant. On the other hand, or whether you're, or whether you're Salesforce, you've got a knowledge. But does this mean that we can expect in the future that employers are going to lead with things like testing, with things like PPP, with things like public health messaging? Are they really going to take this on, or are we going to see this come out of the CDC and sort of defer back to the government? Was it done in the absence of it coming from somewhere else? What do you think? Where do you think the heads are at of these big corporations now?
I think it's going to be really interesting to watch. And if you look at the Edelman Trust survey that's been done for, I think, 20 years now, trust in most institutions has been going down and down and down. Trust in people's employer has remained steady or has been going up in many cases. And for the most part, people trust the company that they have chosen to work for. And that creates a tremendous opportunity. And we talk about that all the time. One of the things that I think COVID has created is you cannot deny that the well-being of your workforce is your business. Like that is, those two things are linked, and you can't separate those. You can't say that well-being is this nice to have thing off to the side. Like, it is the lifeblood of every business. And many organizations already operate like that. And I think more and more are going to take on a bigger role. Will they be able to make up for the vacuum in national leadership or trust in a national system? It's hard to say, but I do think employers are ready to step into that role. There many are.
Yeah, so Matthew, back to your comment about this. So I talked to Scott Shreve, who's the CEO of Crossover Health, which is the primary care clinic, and he coined the phrase health activist employers. And so I think that is definitely something, I think in the folks that I've been talking to as well, employers are obviously taking the lead on this, but I want to point out who I feel like has been jumping to meet them has been some of these really large retailers. So like CVS Health and Walgreens. And if you look, there have been some things that have happened. I mean, CVS all along, we didn't have a national testing plan, but CVS Health had a testing plan that was rolled out nationally. And now if you, when was it, a couple weeks ago with the vaccine, I think it was CVS and Walgreens both signed deals with the federal government to administer that first batch of vaccines to nursing homes. So I think that there's kind of been, in addition to jumping in, the employers jumping in and playing a stronger role, I think that the private sector of healthcare has jumped in as well to play a stronger role and are it's becoming, talk about trust, Jen. It's like people trust their pharmacist, the local pharmacy right down the street. Now I can go there and get my COVID test and my COVID vaccine. And now they're also at work because they've partnered up with my employer. So I think that's interesting how they've really kind of, in the absence of that national strategy that has been perpetuated by the government, retail, why not?
Yeah. Well, and the health tech companies that have tons of VC money to throw around, they're happy to fill in any gap that exists and try to get a solution to scale. But I do think the employer, right. The employer as activists in healthcare is something we'll see more of. And if the employers really threw their weight around the way they could make even faster changes in the healthcare system. And one of my favorite people who managed the healthcare plans for the city and county of San Francisco for many years, Catherine Dodd, she really embraced that role. And the city of San Francisco really got into some big fights with the insurance carriers in order to push for better quality at a lower cost. And so I think it'll be interesting to see where folks are willing to push things and put their neck on the line.
You sound like Ian Morrison. He's usually always talking about organizing those employers into a group and having them like beat down the doors of the health plans.
Well, it's a question: is it finally going to happen, right? So,
yep.
I mean, at this point, they might just be angry enough and cost conscious enough where it might. I mean,
we've got a couple of things, right? I'd love to Jill and Jeff to jump in and sort of to jump in on this. But one is Jill's internet keeps on cutting out because New York City's infrastructure is back in the developing world, right? And we've got to have to do something about infrastructure for this vaccine deployment, right? No question, especially if it requires, there are some things that are going on here, like it requires deep freezing, or which isn't available in many cities and certainly rural towns. And, just looking at the election results, it's emphasized our differences between, the coastal elites in those urban areas, even if the urban areas are not on the coast, and the rural communities are radically different. And then the other thing that's going on here is back to kind of what was brought up earlier on, this issue of hospitals and hospital systems. There are some very in general suburban and not rural, not suburban rich community based hospital systems which have done very well. And as Jeff will, sure, we can tell us, there's a lot which are not doing so well. And now we're going to be asking that, and we're going to be asking, them to make some significant changes about the way we're thinking about this. And yes, all the excitement, all the money is going in. We're seeing all these deals done for Carbon Health, which is going to, was doing startup clinics and is now going to be has been doing a lot of testing, has raised another 100 million here, and Crossover raised 100 million there, and One Medical and Oak Street Health have Oak Street have all gone public, and it's all great. But that's not where the core of healthcare delivery is today, and it's not going to be for a while. Jeff?
Well, Jess mentioned Medicaid earlier, and I thought that was really an important lead, is that we're probably going to have an 80 million person Medicaid program. And I wouldn't be surprised to see 38% of Californians on Medicaid by the time this bottoms. It is the care system for people of color, the care system for people who are not going to be able to work at home, the care system for people that are where the emergency room or a community clinic is their principal caregiver, where the real rubber is going to meet the road. And this is going to be the tough part for Biden. If they don't make a further increase in the federal match for Medicaid, states that are looking at 10 to 15% revenue shortfalls are going to shaft those sole community providers, are going to shaft the rural hospitals, are going to shaft the inner city institutions that were struggling while the economy was booming. So I think that 80 million person Medicaid program, that's a legacy of Obamacare. You expanded the base, and now that you have economic problems, we're going to see 7, 8, 10 million more people in that system. And it wasn't built to handle a quarter of the US population.
Right.
So I kind of wanted to jump off of what Jess was saying about the retail clinics and how do we, roll out these programs and even roll out maybe the vaccine using like the CVS, the Walmart. When COVID hit, right, the minute clinics, the CVS minute clinics were branded so well right before that everybody, there was lines out the door to get these tests done. And in sense that they were also selling their brand. Everybody knows what CVS or Walgreens is. And it was a trustworthy brand. So it's all about, I think, like also what Jen was saying, it's all about the branding and the trust behind who can do this, who can deploy this type of technology, and can we do it at scale? So I really like the idea of even, the distribution protocols for the vaccine through possibly retail, where the everyday American goes and accesses their medicines or, just, convenience store goods, and they can get their test done there as well. Or their
can I just ask you, expand a bit on that, but connecting back to what Jeff just said, right? Because you've been, I know your mother runs a community health center in the Sacramento area. What do you, from your, the osmosis from your family discussions, what's your thing about what Jeff said? If you're going to have a lot more people coming to those places, the community centers, community health centers, public safety net hospitals, all the rest of it. Already been under major strain. There doesn't seem, you had, go back to what Jeff said earlier, we got, what was the number? 1.8 trillion without another stimulus bill for this year coming up, right?
So year that we're in, for the year that we're in.
Right, and then over 3 trillion with the stimulus bill we just had for this year. Maybe we can, I don't see, maybe we get to, we haven't discussed the Senate seats in Georgia, and maybe we get 2 Democrats, and maybe we scrape by a budget we get, but it look, you'd be a betting man or woman to take that bet at the moment. But what do you think the impact is going to be? What are you hearing, across the dining room table from your mom?
Yeah, no, and actually my aunt just, she actually left UCSF to go work for an FQHC because she just was just seeing the need of all these patients. So what kind of the discussions that we've been having at our dinner table is the staff is overworked and underpaid. There's a lot of, they need resources. They can't pay the private salaries. They can't pay the private provider salaries to these doctors, to these nurses. Actually, my mom's clinic had a death from COVID, a specialty doctor who, she's an infectious disease specialist, and she passed away from COVID. So when you start to see, they were so exposed, when you look at FQHCs and sort of these last resort clinics, they don't have the same dollars, they don't have the same PPE, they don't have the same resources, even in California. But then you see doctors who are risking their lives to go after these and help these patient populations. So, setting up temporary clinics outside. I mean, they were just resourceful and trying to just help the patients. So I want to see, what those doctors, and now my aunt included, those doctors are really demanding, proper access, better funding, larger clinic centers, safer clinic centers, because most of these clinics are also operating out of really old facilities. When, if you look at Kaiser, their new school in Pasadena, their new clinics, they have all these like state-of-art technologies, but who's dealing with the really sick and the really poor are the facilities who have the older buildings, have the older technology. So that's really what I've been hearing, is a demand for better protection, a demand for the influx that they will see in the new year, and what they've seen already. And that's kind of what's coming out of my family, what they're seeing.
Well, we'll let Zora off for not being the doctor in her family, because we know she gets some of that crap as it is.
I actually completely went the other way.
So we've got about 10, 12 minutes left. I do want to sort of get to forecast for the next bit for the future right at the end. But I think that we've raised a series of issues here, right, which is the different worlds we're going to come into. Sarah wants to go back and re-examine February, which is not be a bad idea, I think, because there will be another one of these pandemics, and we probably need to have our act together a bit better. But realistically, I mean, given what it's going to happen to the economy, and yes, maybe the vaccine will come. We can't avoid spending the money to whatever it takes to get it done. Clearly, that's a necessity to get us jump started. But I mean, realistically, is there, with a likely Republican Senate, do we think that there is enough? I mean, even if it's like an expansion within a stimulus bill for more payments for states to Medicaid, do we think that there's something that can happen that way to sort of ameliorate some of the things that Zora talked about? Or Jeff, do you think we're going to crash here?
No, I mean, Medicaid is only a piece of the problem. Just to give you an idea, to add another 7 points to the federal match for Medicaid, to take it from the 6.2 that they passed in March to 13.2 or so, is only $55 billion a year. I mean, it's not a huge number, but the revenue shortfall and the deficit forecast for state and local government, where most of our public health infrastructure is 500 billion. And that's the political dividing line. That's where Mitch McConnell and the Republican majority in the Senate have basically said, with Trump's blaring it from the speakers in his, we're not going to bail out those Democrat cities. We're not going to bail out California and New York. We're not going to do it. So, the Medicaid match, I mean, I hope that they're able to sneak it in there somewhere. But the bigger question of state and local governments that are just drowning right now, losing revenues and seeing their expenses increase, that's where the real battleground is. And I'm not a betting man, but they're not going to get, the Dems aren't going to get the Senate.
What about? I mean, Joe mentioned. Sorry, Jen, go ahead.
Oh, I was just going to add that those state and local governments are also big employers. So when their budgets are cut and they have to let go of people, that increases unemployment, pushes people more into Medicaid and elsewhere. So there's a tremendous ripple effect from that.
They're already doing it, Jen. They're already laying people off.
Right, absolutely.
So I mean, this is not tomorrow; it's yesterday.
I wanted to pick up something JL mentioned, which was a bunch of weird states, a bunch of states that you might have expected were legalizing marijuana as part of this. And mostly, I think most of those have came through as sort of ballot initiative. There have been a series of ballot initiatives across also red states which have expanded Medicaid. And done some, I think Wyoming or Montana was one of them, and Utah. Some others. I mean, we've still got the two big, bugbear states out there who didn't do it is Texas and Florida. But I think Georgia did some weird stuff around it with some work requirements, which will go away if when Seema Verma will no longer be administrator, fingers crossed. But I mean, do we think that those states might slowly come into line on the Medicaid expansion, given that there will be some federal dollars there, or they think they're going to? Do we think that the fact that the Republicans running those states are just going to be opposed to it because it has the ACA next to it?
Well, look, guys, I mean, if you've already got, and I looked at the numbers this morning, Florida and Texas, 8 to 10% budget deficits for fiscal 21. They're not going to raise taxes to expand Medicaid. They're not going to do it.
So they get some free money from the feds to do it.
Yeah, but they've got to pungle up money at the front, and that's got to come from somewhere. And if they're faced with, by the way, we're going to have to cut aid to local school districts. That's the largest single state expenditure, is aid to primary and secondary education. I don't think we're going to see further Medicaid expansion out of those red states.
Well, that was, I guess, yeah. I think
ultimately, Matthew, it's going to come down to what is happening with the local economy, and it's a situation that every state is facing, and every state is facing in their individual manner. So, I think Tolstoy said something about all unhappy families are unhappy in their own way. So every unhappy state is unhappy in its own way. And each state is balancing the COVID and the lockdown and the partial lockdown and the partiality of the lockdown or partialness of the lockdown with the hard reality that any lockdown is going to lead to job losses. And job losses means less revenue for the state, and less revenue has problems. So this is a very, very complex problem. I would not simplify it as Democrats versus Republicans or who gets the Senate, who doesn't. It's a problem that we've had for a long time, and that's only coming to fruition right now. I know a lot of people want to deny that there are trade-offs involved in pandemics, and it depends on the nature of the pandemic. I mean, if you've got a contagion that has 50% case fatality rate, then even if you don't have a lockdown, nobody's going to indulge in economic activity. If you're going to be vomiting blood and getting Ebola, you're going to stay at home. But this is not one of those situations. This is a very, very difficult gray zone situation, which is why I get very uncomfortable when people start getting the hammer out and start making moral judgments. I mean, this is a very, very difficult situation. The governor of South Dakota had a very difficult call to make. The governor of New York had a very difficult call to make. And I, for one, I'm not going to make moral pronouncement on either of them. One chose one path, another chose another path, and there are revenue considerations as well. And I think a lot of people that say, oh, you revenue, you greedy capitalists, I think that's naive, bordering on idiocy. Because it's not, jobs isn't just about, money. It's about a kind of a system, an infrastructure, a body that if you destroy today, the repercussions are going to be felt 3 to 5 years from now. And the repercussions of that are going to be felt 5 to 10 years from now. The reason why we had Second World War was because of hyperinflation, because of all the stuff that went on in Germany. Right? So I think, you have to be very careful over here, and you have to give people a little due recognition of the fact that you're playing with a very, very, you're on the precipice between health, lives, unemployment, and it's not simply like money and lives trade-off. That unemployment could also lead to loss of lives in the future and anarchy and problems. So I think that I'm not sure what the right answer is, but I honestly, I'm not willing to entertain. I'm not, for one, losing my sleep on what's going to happen in the Senate race, because I don't think that's going to be the game changer over here.
No, it's your point's taken, right? We don't know, and we think there are a bunch of places in Europe that went one way and it all looked very clever, and then now taking off again. And it's not for certain that the way lockdown has happened that it actually does stop the transmission rates we thought about. Some of those areas are in problems, and it's also not completely. There is obviously a lot of sort of moral suasion where we're okay to have a party in the street because Biden got elected, but we're not so okay to have like a party of motorcyclists get together, So I agree. It does. There is some moral absolutism there, which we perhaps shouldn't be talking about. Jeff, quickly to you, and then Jess, do you want to call, and then we'll go around the horn because we're nearly done.
Well, all I can say is the 72 million people that voted for Trump aren't going anywhere. And the reason why a lot of those folks were willing to pretend that this guy was going to help us as a society is because their situation had been deteriorating for a decade or 15 years and if it continues to deteriorate, there'll be a cleverer version of Donald Trump the next time. Somebody who isn't so consumed by narcissism that he can't mobilize those people and actually do incredible systemic harm, not just by neglect, but by active malice. So I'm very concerned about the divisions in our society right now. And if we can't figure out a way to make a viable working class, not just for the Trump people, but for those people of color that need to, a leg up. And we're really, the problems that we're having now are not going to get better.
Yeah, no, I mean, I'd agree, and I'd say that we have to. The obvious way this happened, we have the example of the 30s and FDR, and we need, to my mind, I don't know how we get there. We need we've got the Green New Deal and these other options. We need a big infrastructure campaign in lots of parts of this country, including rural Texas and rural counties, including inner cities, and including getting better internet access in the jail's apartment in the Upper West Side. So, right, with that, we are very close to the end of this episode of the THCB Gang. So I'm going to go around the horn and ask everyone for what they're thinking they're going to see in the next couple of weeks, starting with you, Jennifer.
Jennifer, so formal.
Why am I so formal with this? Jen and Jeff. Sorry. I'll be saying Jeffrey.
In the next couple of weeks, I would love to see a little bit more of a definitive response from the Republicans on the presidential election, but I'm not going to hold my breath on that. And I think it's going to be very interesting with states and cities starting to put some more lockdown measures in place. Do people say, yeah, let's do this and let's prevent another wave, or not? So I hope that we'll see a little bit more collective action for everyone's goodwill on the COVID side, but I might be being way too optimistic on both of those points.
JL, or should I be calling John Luke, as I'm being formal today?
And apologies for blowing up the show today with my internet here in New York. I think what I'm looking forward to and what I'm paying attention to is Biden, President-elect Biden, as he builds his team. I'm very interested to see, who is mentioned for HHS posts, for CMS posts. I think we probably end up seeing a lot of Obama-era people. And I think, the decisions, the staffing decisions will be clear indications of the policy direction that Biden plans to take us. And I think we'll learn more about that in the next week or two.
Jess.
Mr. Holt. Okay. I don't know what to predict here, but I guess I have a question, or maybe there's like an over-under on this in Vegas. When or will Trump ever accept the election results? And how long will it be before Calm, in another deft move of sponsorship, finds a way to get a hold of his Twitter account and provide a mental health analysis of that guy and everything he's tweeted over the past 4 years?
Yeah, if you didn't see that, Calm sponsored a whole bunch of stuff on CNN. It was very clever.
It was brilliant. That was one of the most brilliant advertising moves I have seen in a long time. So Calm sponsored the returns of the election results on like CNBC.
Sarab.
Yeah, I'm actually, like Jessica, looking forward to Trump's concession speech. I think it'll be like Satan's concession speech when he was thrown out of heaven. I don't think that it's going to come in the next 2 weeks. I think what we're going to see in the next 2 weeks will be a lot of panic about the rising hospitalization, a lot of arguments about the death rate, and a lot of let's wait 2 weeks before we really know. So, as they said in Alice in Wonderland, jam tomorrow, not jam today. So with COVID, the argument gets deferred to 2 weeks from now. I think that the panic is going to outstrip the reality, and it's not really going to help matters, because anytime you panic, you have a counter, because you lose credibility and you think that doctors are just making stuff up. So unfortunately, my concern at the beginning of what I said is going to keep being prolonged.
Right. So we've had, what was that? That was Tolstoy, Milton, and Lewis Carroll all today from the Red Doors. Jeff, some comments for what you're thinking the next couple of weeks you're looking for.
Well, I'm really hoping for a major progress on a stupidity vaccine, honestly. You know, people having Thanksgiving celebrations and Christmas celebrations indoors in cold weather and going into the bars and hail fellow well met. I think we're really, I mean, from the base of 140,000 cases, there's a whole lot of upside here.
Yeah, it's quite a frightening prospect, and I think it is unprecedented, and I keep going back and saying, okay, maybe we get the vaccine, but the 1918 flu case killed a lot of people, lasted 2 years, and we're still only 9 months into this one. Really well, they're longer if you live in China, but they seem to figure that out. All right, and last but not least, I'm going to give her a bit of an intro here. I'm going to go to Zoya, but this is Zoya's last week as at the healthcare blog and working with me at Smack Health, and she's been working with me for 2.5 years, and I'm super grateful to all the work she's done. She's moving on to a post as she's going to become one of those voracious venture capitalists at Civilization Ventures, where she'll be looking at both digital health technology and using her degree from Northwestern in neuroscience, looking at sort of life sciencey type stuff. So we're very sad to lose her, but it's a great transition. And Zoya, what are you thinking out for the next 2 weeks and for the rest of your life?
Oh my gosh. Well, thank you again so much for that exitro, I guess, Matthew. It was it's been such a pleasure just meeting so many great, people and just learning so much. As the token millennial is what Jess has called me, I think I've learned a lot, and hopefully, I'm really excited to see there's so much involvement from Gen Zers and millennials in this space. I mean, there's so, they're so involved when you're looking at their TikTok communities, you're looking at their, Instagram communities, and just seeing how they demand healthcare, or I guess I should say we demand healthcare going forward. And that's in my future projection, but also, becoming an investor and kind of going into that space. I'm really intrigued to see the innovation and practices around elder care, and how are we helping, protect our elderly population. When we saw grocery stores react and say, we're going to have this hour for just, folks over 65 or 70, that was a protection measure. Why couldn't we do the same in our healthcare clinics and our, in our hospitals? So I'm really, really focused in that. That's the thesis I've told, my new boss is what I want to do. So if you are ever, have a health tech startup, for anybody watching, please come hit me up at Civilization Ventures. It's a great team. We're going to be investing in health tech and synthetic biology and regenerative medicine. So I'm very excited, but today's such a bittersweet moment. I'm really going to miss the team.
Well, we'll all miss you, Zoya. All right, and with that, we are done for this episode of the THCB Gang. Want to thank my guests, Jen Benz, let's see, I don't know, Jennifer, Jen Benz, Jessica, or Jeff Damas, Jeffrey or Jeff Goldsmith, Saurabh Jha from Rogue Rad Radiology, John Luke Neptune, JL, who you can find at Center of Modern Recovery. We didn't talk much about opiate addiction this week, although I think the numbers are probably going to go up a lot after the last couple of weeks. And of course, my colleague and friend, Zoya Khan, who's been editor-in-chief of the healthcare blog for the last couple of years. Matthew Holt, signing off. We'll see you again this time, same time, same place next week, 1 p.m. Pacific, 4 p.m. Eastern, and also on the podcast for THCB Gang. And that's the end of the show for November the 12th. Thanks a lot for listening.